through them quickly?
Absolutely. We'll just go quickly. So the non-surgical treatments are medications, PRP, low-level laser light therapy, and we'll just talk quickly. So Minoxidil, also known as Rogaine, if you're buying the trade name, is typically 5%. You apply it ideally twice a day, and you will get great outcomes because it increases the amount of blood flow to the area and will help you maintain hair that you still have and grow a few new hairs. But I want you to know, if Rogaine could grow a whole head of hair, we would never have to do hair transplants. So it can help you get some hair back and maintain the hair that you have. But if you have a bald head, it's not going to grow a whole new head. And one of the things you should be aware of is when you start Rogaine, initially you may see some shedding before you'll start to see growth, and you really won't see a change for 6 to 9 months. And the other thing is you have to use it forever or for the rest of your life if you want to maintain your hair, because once you stop using it, eventually the hair that it's helped you grow or maintain will start to fall out. The next great drug is finasteride. Finasteride blocks the conversion of testosterone to dihydrotestosterone by interfering with 5-alpha reductase, which is the enzyme which causes that change. And for men, it's particularly effective because the hair on the front of your head has the enzyme that converts testosterone to dihydrotestosterone. So by taking this, it'll help you maintain the hair you have and help you grow some new hair. The dose for men, if you have prostate trouble, is 5 milligrams. If you want to take it because you want to keep your hair, it's a very low dose. It's only 1 milligram. And the same thing, you won't see change for some 6 months or so, and you have to stay on it for the rest of your life if you want to maintain that hair. Women, the effects are not as good as they are with men, and the dosage is much higher because women's hair loss is not necessarily related to testosterone and dihydrotestosterone. And we typically recommend it for women who are postmenopausal. It's probably dangerous to take if you're of childbearing age because it can affect the testosterone of a boy and cause it to turn to estrogen and can feminize some of the male genitalia. And also, if you're a woman who's had breast cancer, it can convert your testosterone to estrogen. And so estrogen receptor breast cancer makes it not an effective or not a safe drug to take. So men, it's particularly effective. And for women who are postmenopausal, it may be effective as well. Related to finasteride, go ahead and change it, Michael, is Dutasteride, which treats, there's 2 types of 5-alpha reductase, and a type 1 and a type 2, and Dutasteride interferes with both of those. And so it's probably more effective in giving you to treat your hair loss. And most research shows that it's more effective. However, the side effects are slightly more common, and those side effects for both of these drugs are sexual side effects, and most people are referring to impotence, but also breast enlargement. And it's been shown if you're somebody who's depressed, it may make your depression worse. And so if you have some mood issues, you may not want to take this medication. And it's, for the most part, more recommended for men than women. Platelet-rich plasma is something that we provide for every one of our surgical patients, and a common medication or a common treatment that we use for women with hair loss. And just sort of quickly, platelets have many growth factors within them that help you grow and maintain your hair and help thicken hair. So every time you get a surgical treatment at Northeast Hair Restoration, you're actually going to get a PRP treatment as well. Women who have hair loss for a myriad of reasons, but particularly for female pattern hair loss, respond very well to platelet-rich plasma. And so we do many PRP treatments for women. It's relatively easy. It takes less than 60 minutes. You're using your own blood, so it's safe, and it's quite effective. This is the actual procedure. We take your blood, we centrifuge it down to the platelets. We add medication that causes the platelets to release their growth factors, and then we inject it into the areas of your hair where you want to thicken or grow your hair. And then this is what these growth factors do. It stimulates stem cells. It increases the blood supply. It reduces inflammation. It prolongs the anagen or growth phase of your hair and will strengthen or thicken your hair shafts. We typically recommend 3 treatments. This is so like after a surgery, we'll do 1 procedure during the surgery, and then we'll recommend you come back at a month and then 3 months afterwards to have a treatment. And women who get PRP treatments typically get 3 PRPs a month apart, and then we recommend maintenance every 6 to 12 months to help sustain that thick hair that you're getting from the PRP. And so who are the ideal candidates? Ideally, it says here, early to moderate hair loss. So you want to start as soon as you can to try and maintain the hair that you have. It's nice because it's non-surgical, and so for people who are looking for treatment without getting surgery, it's great. It's great after you've had a transplant. It's great for people who can't tolerate medication, and ideally for women, it's a great way to treat their female pattern hair loss. And then, so it says androgenic alopecia, which is sort of an older name for female pattern hair loss, but it's a bit of a misnomer because androgens are not really a major cause for female pattern hair loss. And so it's effective for both men and women. And it's always been shown if you do something else, if you get a hair transplant, if you use low-level laser light therapy, if you're on medication, if you do this in addition, it's going to enhance that treatment as well. So that's exactly what this slide says is PRP plus a hair transplant is going to improve your outcome. So the graft hair length and survival is better. Your hair will come in quicker, and there's less inflammation following the surgery. We typically put it on your scalp or put it into your scalp and then put the transplant into the PRP to really create an ideal condition for the new grafts. In addition, the hairs that are already there, it will help them become thicker and stay following the surgery. Whenever you have surgery, there's some inflammation and healing required, and it'll help with that. And decreases, whenever you have surgery, there's a risk of losing hair because of shock, or what we call telogen effluvium, and this will decrease the amount of that occurs as well. Another form of PRP, and has been specialized at Meditress and Northeast Hair Restoration, is people have done research to determine what's the optimal number of platelets that should be used in order to get the best outcome, and that's between 1.4 and 1.6 million platelets. And so what they'll do is they'll take your blood and create that number so that you can get the optimum benefit from the platelets and the PRP when you're getting this treatment. And, a lot of people do PRP. However, Meditress has done many thousands of PRPs, far more than anybody else in the area. And so when you come here, you are getting well-experienced people who know what they're doing and have done it many times before and have seen great results for all these patients. I think this is close to the last thing. So low-level laser light therapy was first discovered probably in the 60s when, I don't know really why, but somebody used a laser on a rat that had hair loss from chemotherapy, and they found that it would grow hair. And so from that, people said, oh, let's try using laser to help with hair growth. And it turns out, in particular, red light is helpful for hair growth. and for wound healing. And ideally, laser is even better than just, say, the classic red light. And so, and the reason is laser will go deeper into your tissues in order to affect the growing part of your hair or the bulb. And there's been many research studies. It's now cleared by the FDA for treatment for hair loss. The lovely thing is it's not medication. You use it 20 or 30 minutes every other day, and you can share it with your partner if you want to. It's effective for both men and women. And how does it work? It increases ATP production. It'll bring more oxygen and nutrients to your hair that require that. It gives a great growth environment and tends to shift your hair from telogen, which is the dying phase, to anagen, which is the growing phase for your hair. So the more hair that's in anagen phase, the more growth you'll get, and decreases the oxidative stress that just happens from your day-to-day life. Here's sort of the evidence related to why you should use this, and I'm not going to go through the whole thing, but it will help with all these different hair loss. I seem to have lost you, Michael. I lost you guys for a second. Are you back?
Just in these, I just want to show that in the one on the left, the reason you see the part a little bit brighter is because there's certainly more hair in a darker area as opposed to the diffuse thinness that you're seeing throughout that area. On the right, you can see the temporal area is being filled versus what it is. Next slide, Mike. And again, you can see a similar thing where the part is short, smaller, and here in the crown, you've got growth back. Next slide. Want to tell them I want to choose us?
Can you hear me? You all?
Yeah, we can hear you.
Okay, because everything disappeared there for a minute for me. But so Northeast Hair Restoration, obviously we're promoting ourselves and we want to give you as much information as we can about hair loss and hair treatment. But you're talking 35 years of combined experience that we are happy to apply to treat you. There have been thousands of procedure and we have a proven track record. We will be able to provide you what the best treatment is for you. And not only do we do hair transplants, but we do everything else around hair loss to give you the best possible result for your personal hair problem. And we guarantee all of our work. So if for some reason there's some issue, we will take care of it no matter what. And if you have any questions, we want you to call the office and schedule an appointment. You can meet with Mark or me or any of the many consultants that we have to help you with your hair loss.
The last thing is, I just want to let you all know that we, the physicians, surgeons, do all of the surgical parts. There are some groups that do not do that. Just make sure that you're told the number of grafts that you will receive and how many you received. And in your consultation, make sure that you ask if the physician is the one who does the surgery. Now for some questions.
Are you able to see questions? I don't see anything there, Mark, so
No.
Okay.
Huh? There's no question.
Well, if you do have any questions, Mark and I are always available.
Yeah, I have a couple here, Thomas. So
Okay.
Let me go to the cost for our procedures. The cost varies on what one would need. This is not a place that I can truly give the answers, but would be happy to discuss that in a consultation. In terms of percentage of women do we work with? Well, I'll be honest with you, when I started my practice 25, 30 years ago, 20% of my patients were women for surgery. Today, with the alternatives for medical treatment, I'm seeing less than 3% of the women, and they're all going to our Meditress side because, once again, we're the leaders in women's hair rejuvenation throughout New England and New York. And microblading is something for the eyebrows, as you know. It doesn't last. It's not permanent. Occasionally it may blend, and there's no 3D to it. It's all, it's all flat. I will admit that it looks great, but for me and the patients who obviously do it, they're much happier with the real hair there. I have done numerous patients who have had microblading done. They were happy with that overall, but once they had the procedure done, they were thrilled. Oh, microneedling. Okay, microneedling, we do that. That is done with the procedure. With the hip, when you're doing it with surgery, it's automatic. When you're doing it otherwise, we do microneedling after injection, and we do have a system where it's a painless. We don't have to numb up your scalp. It's a high velocity injector, which actually, through high velocity air, injects it into the scalp at the level of the follicle, so there'd be no pain. No shave is no different than the rest of the FUEs or FUTs. It is a permanent solution. The hair we transplant will last as long as the place we took it from. And the place we take it from, the expectation is that that hair is permanent. It's called the safe zone.
And as far as PRP versus low-level laser light therapy, they're both effective. And ideally with women, you want to do everything you can as far as your hair loss goes. And that means diet and probiotics and vitamins and minoxidil and low-level laser light therapy and PRP and whatever else that the therapist may recommend, because a lot of women's hair loss is not necessarily due to just female pattern hair loss, but it may be related to other autoimmune diseases, or it may be due to a scarring alopecia that require completely different treatments that we haven't even listed here.
Okay, I do not see any other questions on here. If you have any questions, feel free to call the office and ask to speak to either myself or Dr. Brand. We would be happy to answer questions. If you would like to schedule an appointment, you can go online to northeasthair.com or you can call the office for that. We really appreciate all of you being here and hope to see you in the future. Again, with any questions, give us a call. Thank you.
Thank you.